Welcome to NCPDP Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
Lew, thank you so much for joining me today.
Thank you for having me.
I have to start off with, first, why don't you tell our listeners who you are and where you're from?
I am the Chief Technology Officer for Arrive Health, based out of Denver. Basically the head nerd and make sure that all of our technology runs smoothly, and also Colorado native, so.
Nice.
Yep.
So speaking of the head nerd, as we were chatting before we started recording, you shared that you have a degree in geology.
I do. Actually went to Colorado College in Colorado and originally studied biology, but then fell in love with geology and love rocks, primarily paleontology. And that brought me into technology because I started doing mapping for geology, and then that got me into programming, and then eventually I took a turn into health tech.
So why don't you tell us a little bit more about that? What led you all the way up to working in real-time benefit checks and prior auth?
I've been working in health tech for a long time, and I was introduced to the company very early on before they even had an office. And our founder, Kevin O'Brien, who's actually an MD, kind of the impetus for the company was his struggle to get his mom's medications paid for. She was really struggling with her costs, and he, as an MD, thought I could solve this problem. And so he started doing a lot of research on, cost savings, different ways to, manage costs for medications. And he was going to write a book. And Carm Huntress, our founder, got involved and basically said, no, this needs to be a technical solution, because as soon as you write a book, it'll be out of date. But that was really the driver and the mission behind the company. Our mantra is Lucy Up. That's Kevin's mother's name. So
Okay.
we have her face plastered all over.
Wow.
And I don't know, that mission really spoke to me. I've had my own healthcare struggles from an early age, and know how expensive care can be, and bringing transparency into that is a mission that I believe really strongly in. So that was in 2013, and I've been giving the company free advice for about 6 years before they finally said, hey, we think your advice would be better if you just came on board, and that was in 2019. So
That's the best way to find a good job, isn't it?
right.
So you do a lot of research, is that right? In this area?
Not a lot of research, but
No.
we do a lot of work in the transparency area for sure. And it's mostly about connecting partners and content from one side of our network to another.
So what have you found that is still so challenging for the industry to have better adoption of prior auth?
It's a great question, and obviously one we discussed in detail yesterday with some of the smartest folks in the industry. And I think we're getting there, but I think it's definitely a manifold problem. But I think one of our biggest barriers is kind of what we would call the top of the funnel, right? How do we initiate a PA? Let's start with, how do we know which PBM has that member's benefit to even go ask if a PA is required? And then, once we know that, how do we find out if a PA is required? And right now, oftentimes F&B is at the top of the funnel, which is very inaccurate because it's not member specific. And that generally creates a lot of noise in the system. And, providers, when they have to do things that are a waste of their time, they tend to unsubscribe.
Sure.
And so, one of the biggest barriers is just unnecessarily initiated EPAs. So, we have solutions for these problems. Real-time benefit obviously is more accurate than F&B. And, I think that we can come up with a much better solution if we can, kind of narrow the top of that funnel and make it a better user experience. And then I think downstream, it's really interoperability, right? Having access to the data, being able to transmit data automatically to answer kind of upfront all those clinical questions. And I think that's really low-hanging fruit. So, I think solutions are out there that are just difficult to implement and get going, especially with the myriad of players in our industry. But we're doing great work.
Yeah. So going back to, you mentioned some interoperability and also sharing of data. So when you think about all of those data highways, this information that has to go between what I like to call the 3 Ps. We have the patient, the provider, and the pharmacist, right? So what standards can you think of that are really vital to creating those highways?
Yeah, I mean, obviously, eligibility standards up front, right? And I think that's a place where NCPDP is kind of, not the main player, but I think there's an opportunity there. And then obviously downstream, the EPA standard and the real-time benefit standard working together in concert. Mm-hmm. And I also think the F&B standard, has its place. And I think we just have to discover the use case that each standard needs to fall into, right? And I think also a key piece is the standards need to be flexible. Mm-hmm. Our pace of releasing standards is okay, but a little bit slow compared to, other parts of the other areas of the technology industry, right? And, I think we've done a good job of making them more flexible recently. Mm-hmm. But we need to be able to continue to iterate on better and better solutions, particularly as the new standards get implemented in the market. Mm-hmm.
Absolutely. So what work group would someone want to join if they wanted to get more involved in this?
Definitely the EPA work group, which I think has been renamed from the really long name that I won't even try to remember. And then, I would also obviously recommend the real-time benefit work group and task groups.
So let's go a little bit of a different direction. So what are your thoughts surrounding how improving prior auth and real-time benefit checks would impact patients?
I've had this experience many times where I didn't know my script was blocked by a PA, and I was wondering what was going on. And typically my providers have been able to resolve it, get through the process. Mm-hmm. I didn't even know, right? You don't know until you get a letter in the mail that you've had a rejection, and then, it's been resolved and you can go to the pharmacy and get your meds. I think that that's a really poor experience for patients, right? Mm-hmm. To be blocked at the pharmacy. And so the key piece there is to pull everything upstream and make it as smooth and automated as possible. Mm-hmm. So what does that mean? That means having accurate information about what requires a PA and handling that PA prospectively before the script hits the pharmacy, so the pharmacy doesn't necessarily have to get involved. That's an ideal case, right? Mm-hmm. And I think as much as we can do that, that's just a better experience for everybody in the network, because there's not as much communication back and forth. There's just not as much friction. So I think the real key is to push the PA process upstream and streamline it for providers and care teams. And I think also bring transparency to patients that PAs are happening and that mm-hmm. it's moving, and not leave them in the dark about, what's the status of their script.
Yeah. So I was just, as you were talking, I'm sitting here thinking, having this process be a little bit more fluid and be real time would make a huge impact on medication adherence because patients would actually pick up their medications on time. And I feel like a lot of times when a patient gets to the pharmacy and they get that initial, oh, we can't fill this right now, or we can't give it to you right now, or it's $700 to pick it up until we figure this out. And they never come back, even when they get that letter in the mail that says, oh, we resolved this. I think a lot of times it's just they probably haven't, or just so much confusion on the patient's side that what a huge impact to outcomes, to adherence, to patient care in general.
100%. I think that's the holy grail, is to, drive adherence and make sure that the patient can get the right med at a cost they can afford without any hassle right up front. And,
Agree.
If they can't, right, if that med is not covered, or, it's not the right medication for them, getting information back to them and the provider on what their alternatives are.
Sure.
It's so important. So you're 100% right. Like, we need people to be cared for, and in order to do that, they need to be on med, and they need to be able to access those meds the first time, and we can't break the bank.
So we've talked a lot kind of about the utopia of this whole process, right? But what would your feasible next steps be?
I think our organization's next steps are, driving prospective EPA, and also working with our PBM partners on, codifying health information so that we can smooth the process and get them answers before their questions are even asked, right? I think a lot of folks in the industry are doing that. And, that's certainly the hill we're charging as well. And I think, a rising tide raises all boats. I think we're going to figure this all out together, and there's opportunity for that. And there's certainly opportunity for the standards to help drive that, right?
Yeah.
And, I really think that's our next step, is leveraging the data access that we have, all of the healthcare events that we see are through our system, and other data sources and interoperability standards that are out there in order to bring this all together like it was supposed to be years ago, right?
Sure. Yeah. Well, thank you again for joining me today. I like to wrap it up with something a little fun, so I'm going to put you on the spot. But why don't you tell us, what is your favorite rock of all of the rocks?
My favorite rock.
What is your favorite
of all
rock?
of the rocks?
Of all the ones you've studied and learned?
That's a great question. I was saying earlier that one of the favorite ones that I have in my office, it kind of reminds me of geologic time, right? And that, kind of time sort of heals all wounds, creates things of beauty. And so I have basically a rock that has a bunch of ammonite fossils in it. And ammonites are special because they allow you to date, sedimentary rocks that are fossiliferous, and they tell you, basically whether they fell before or after the Permian extinction.
Okay.
That is a lot of rock nerd. But that's probably my favorite rock, and my favorite fossil. So
Thank you so much for sharing. And again, thank you so much for being here today.
Thank you. It was great.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.